Yes, so I was invited to sort of present the work of a group of healthcare professionals in the UK. It was part of the UKMF, and it was a British Society of Haematology guideline that we put together. So this was on the late and long-term effects of myeloma. So pleasingly, myeloma patients are living much longer than they did sort of 10, 15 years ago, and consequently, with all the newer treatments as well, we're seeing an increased range of longer term effects, and helping patients to manage that through education of healthcare professionals with this type of guideline was the aim. The guideline we split into two broad categories. So the first was the physical effects. So these are things like infections, heart problems, respiratory problems, second malignancies, which, when people have had chemotherapy, they're at a slightly higher risk of, and also things like bone problems, endocrine problems, basically the sort of systems of the body that can be affected by the disease and the drugs that are used to treat the disease. But importantly, I think this guideline paper, also covered the other effects. So this is the psychosocial effects. So the effects on emotions, finances, social life, ability to work, just those sort of holistic problems really that can be encountered by myeloma patients. We finished the sort of writing of them towards the end of last year, and they were published in the British Journal of Haematology in January. So they are freely available on the internet. They're published guideline now. The other point is that the guidelines are for predominantly for myeloma healthcare professionals, but they're also very much directed at other specialists and primary care, sort of GPs, who are increasingly involved in sort of management of patients if they're not on treatment or they're being looked after more in the community, and with other problems such as heart problems, renal problems, they'll see other specialists. So it's about that sort of understanding across the whole spectrum of myeloma care, and the specialists involved in that. So hopefully they'll be useful for a range of professionals.